Hi, this is Dr. Jim Vermillier with Cognitive Behavior Therapy Associates talking to you a little bit today about mood disorders. So, all of us experience ups and downs in our moods, and this is normal. Indeed, one of my mentors in the past said that, the true sign of a normal mood was that it was reactive. And reactivity of mood just means that if you're having a sad event, you feel down, and if you're having something that should make you feel happy, you feel happy. So when things are going well, you feel good, and your mood fluctuates around some, kind of normal baseline, if you will. I usually have people rate their moods on a scale of 0 to 10, and most people's mood isn't a 7 or 8 all the time. What happens is that their mood, varies around, say, a 6, so that their mood is more or less a 6, but, some days are 7, some moments are 8s, sometimes they're 4s, and, so their moods vary around that. The mood, generally speaking, though, is felt to be good, and symptoms that you are associated with depression are not present. Now, depression is characterized by a low mood, which has been around for at least a month and is not due to some type of bereavement. If bereavement goes on for more than 6 months to a year, then you might want to consider examining whether or not it's turned into depression. But sadness and many of the symptoms that go along with depression are natural accompaniments of bereavement if you've lost someone. So make that differentiation first. Now, if you feel like you've never really felt good, and this has persisted for many, many years, this can often be what we would call dysthymia. And dysthymia is kind of a chronic low-grade depression that at some point almost becomes an aspect of one's own character. So that someone might feel that they're just kind of chronically down, blue, sad, that they've never really felt as good as they would like to feel. The another type of depression is major depression, and major depression is characterized by a number of different symptoms, and you don't have to have all of them to have major depression, but you might have early morning awakening, you might have difficulty falling asleep, you might have shortened duration of sleep. Sleep is often disturbed in terms of its quality. People might not feel that they're as rested as they would like to be. They can be irritable. Feelings of worthlessness or hopelessness often come along with depression. The energy level can sometimes be low. Concentration and memory can be impaired. The person feels like they're really pushing themselves to do things that they would ordinarily do without much difficulty. And another characteristic is that they feel that they're not deriving the same type of enjoyment from activities that they used to enjoy. So they might have enjoyed fishing or reading, but are really no longer doing that because it just doesn't help them feel any better. So people stop doing a variety of different things and sometimes, find it difficult to get out of bed because they're thinking that there really isn't much point. They don't enjoy anything anyway. So depression can be a real drudge to kind of live through. And sometimes people have thoughts that life isn't worth living. Now let's talk about that for a minute. Suicidal ideation, which just means thinking about suicide, is not something that automatically needs to be reacted to with all resources available. The question is whether or not the person is feeling that they might actually harm themselves. And if this is the case, then you really do need to seek a competent evaluation as soon as possible. And if the person is thinking about harming themselves, you probably should take them to an emergency room or to a qualified provider immediately. And if a provider is not available immediately, then you should probably head to an emergency room where you can get a psychiatric or psychological evaluation. But suicide is something that happens with a broad variety of different problems. It can happen in conjunction with OCD or depression, with the opposite of depression, which is a manic mood state. it's an expression of hopelessness or a feeling that things aren't going to change in your life. So we treat suicide very seriously here, of course anyone would, and try to help people feel better so that they no longer feel that way. So back to depression. Depression can be characterized by all those different symptoms. One of the effective treatments that's available here at Cognitive Behavior Therapy Associates and at other cognitive behavior therapy clinics is an approach that has been around for some period of time and has been shown to be roughly equivalent to that of antidepressants. And that's cognitive therapy, or cognitive behavioral therapy. In cognitive behavior therapy, what we're trying to do is work with a person around what kinds of thoughts they have and how that influences their mood, and ultimately try to be able to help them influence their mood in a positive direction by changing the way that they think. We'll talk more about that in another installment of Mood Disorders.